Hi, I'm Dr. Thomas Williams. Been in practice here in Montgomery, Alabama for about 40 years now. I just wanted to take a few minutes to talk to you a little bit about what I've learned and how I have developed a practice model that really works for me. And it may not be for everybody, but it does work for me. First of all, let me just I want to give thanks to Dr. Pete Dawson and the Dawson Academy, also the L.D. Pankey Institute, Hilt Tatum, the Alabama Implant Congress, and the American Academy of Implant Dentistry. All of these have kind of helped to formulate and mold my practice and me and as a dentist to the kind of dentistry that I do. I was taught by Dr. Dawson to do thorough and complete exams, and it is quite frankly very hard and really almost impossible to do that just simply seeing a new patient in the hygiene room, and all you got is 5 or 6, 7 minutes there to spend with that patient, and you've got other patients waiting on you. So I just kind of did some soul searching several years ago and decided that I would change my model of practice. And here's kind of what I have learned and developed. Number one is that we see new patients as a complimentary look and see appointment to get to know them. I see no other patients. I do have some hygiene patients scheduled, but I see them in the doctor's operatory. We have screened them in the consult room, gotten their vital information. We have confirmed their insurance coverage. All that is in the computer. They have sent their paperwork in actually 2 to 3 days in advance minimum, so that my staff can be prepared, and the patient when they arrive is not, other than having to get a signature maybe or hand them just one more consent form, it's a simple matter of greeting the patient and then not having them wait, but immediately we bring them back. We do take a CT scan on every new patient, which also provides us a panoramic view. It gives us a 3D dimensional view to evaluate pathology, and especially we look at endodontics and root canals, because we can see things on 3D that you just can't pick up necessarily on periodical x-rays. So I'm in a casual environment. I spend anywhere from 10 to 20 minutes with each new patient. I have a time to get to interact with them. I am relaxed, and I really enjoy this every Wednesday morning. I love coming to work on Wednesday mornings because there's no stress when all you're doing is meeting and greeting people and examining them. So then in a very positive way with good hand language and body language, we just kind of love on them and listen to them, and we ask them questions like, what can I do for you? What are your main concerns? That's kind of how we talk to the patients, and we just talk from our heart. We don't talk from our head, but we talk from our heart, and patients can pick that up. Several years ago, when I realized that patients can perceive, if you have dollar bills in your eyes, they perceive that. So we're not really talking about finances and trying to of a practice and trying to earn enough productivity and that type of thing. What we're talking about is just being honest and straightforward with our patients, loving them, getting to know them, listening. God gave us 2 ears for a reason, 1 mouth and 2 ears. And the reason He gave us those 2 ears was for us to ask questions, not with yes or no answers, but, well, tell me how you feel. Tell me what you'd like to change. Tell me about your problems. Tell me more. Those are the kind of questions, and we are listening. We look them eye to eye. We're not looking down at their paperwork while they're talking. That's a no-no, okay? And we're just spending some time, and you will be amazed at what the patients. And then so many people come in and they will tell me, well, Dr., I'm terribly, don't take this personally, but I'm just terribly afraid of the dentist. And you know what I do at that time? I reach out my hand and I touch their shoulder and say, it's okay. I said, I love getting patients like you. I'm sorry that you've had a bad dental experience in the past, but dentistry doesn't have to be that way. And we just want to let you know that we're not going to hurt you, and we're just going to love on you, and we want to help take care of you. And we have ways of sedating you. We deaden it before we deaden it. So I appreciate you sharing with me your concerns about bad experiences or fear of the dentist. But we're glad you're here because we want to make you a missionary of our practice. And that's how I talk. So then we do have at our disposal there we have intraoral cameras. We have extraoral cameras, but the intraoral camera has really been revolutionary in the last few years to actually just say, let's just take a look on the television screen. We have big monitors in the treatment rooms, And let's just take a look at your mouth. And the reason we're doing this is we want the patient to co-discover with us their dental health and their dental problems. And it is amazing how people do not really see inside their mouths. And when we take an intraoral camera and we hold it up and we're doing this for a couple of reasons. One, we want medical legal documentation. You won't believe how much you need that in today's society, but it's always good to have some photographs of before anybody has picked up a scaler, before a hygienist has touched them, to have documentation. And for diagnostic purposes, I need to see their mouth before a hygienist has cleaned their teeth. I personally think that is wrong in a dental practice. It's not smart anyway to let the patient come and get their teeth cleaned, and you didn't see any evidence of what their oral hygiene, their home care was, what some of the initial periodontal considerations were. All you're seeing is maybe scale teeth and some bleeding gums after cleaning. That's just not appropriate for diagnosis. You need to see the patient before a hygienist picks up an instrument, quite frankly, you know. And I know for most practices that's what you do. Patients come in, they see the hygienist, and that may work fine for you. I'm just telling you that I have found a method because what I'm trying to accomplish is to do a thorough, complete exam for that patient and sit down with them and talk with them about their dental needs in a way that has worked for me for them to accept treatment. To give you an example, if you walk in and say, "Hey, I'm Dr. So-and-so, what can I help you with?" and they say, "I want my front teeth capped or crowned." Well, you look at them, and then the next question, the patient says, "Well, how much is that, doctor?" And then you quote them a fee. You've not gotten to know them. They've not gotten to know you. Their experience is just all about dollar bills in most cases. Now, there are exceptions to that, and maybe they're referred by their wife or husband, and they already know who you are, and they just are interested. But even still, I think it's important to develop a relationship and then talk with the patient, get a real feel for any other concerns. You really want to have time to digest the information, and quite frankly, if you've got 2 or 3 other patients waiting on you, just as a human being, you're not going to process information as well as when you are totally dedicated just for that patient. So then we take the intraoral camera and we will go around and especially look at the lower linguals. We'll look at the bite on the right side and centric occlusion. And centric occlusion will take different views of the upper and lower, and they will see this on the big monitor, and then they go, "Oh wow, doctor, I never knew that." We will show them decay in their mouth. We will actually take the probe and touch papilla areas that are inflamed and show them bleeding on probing. And then they go, we tell them now, this is dental disease, this is infection, okay? We don't know how involved it is, whether it's just gingivitis or periodontal disease per se, but we want to look more into that. But you definitely have some inflamed gums, and bleeding is not normal like that. So that's how we talk to them. And then we take, go around the tour of the mouth real quick, and my assistant is taking notes as I'm talking so that I'm not writing down. My assistant is basically taking dictation and kind of her shorthand, taking notes of what the patient told me and what I told the patient and what we found. And then we also show them their 3D and their panoramic, and we look at that, and then we tell the patient, so how do you feel about what you're seeing here? And you will be amazed what they will tell you. And some of them will cry. You better have Kleenex in the room. You're going to hear everything under the sun from why they're in this condition or how embarrassed they are. And you just love on them and say, it's okay, we're here to help you. And then generally, 9 out of 10 times, what we'll do is I'll tell you what, Ms. Jones, let's do this. Let's be very thorough with you. I want to treat you like it was my mouth. And let's get you back. We will clean your teeth if that's what you need, or we'll need to start some initial gum treatments or periodontal treatments because your gums are infected. But let me get some records. We're going to take some jello impressions, and then I have a jaw simulator, which is called an articulator, but we can take some actual impressions, and I can look at your bite and see how your teeth come together. We're going to take a complete set of x-rays, some zoom-in pictures. We're going to check your gum condition. Then I'm going to study your mouth like it's mine, and then let's have you come back, and we'd love to have your spouse come with you or a significant other, and let's sit down. We're in a comfortable position for you, and let's just talk about some different plans, and we may give you plan A and plan B. But let's put together a plan that'll be the right plan for you, and then you make the final decision. How does that sound to you? And then you pause. 9 out of 10 patients, that sounds great, doctor. I have never had another dentist talk to me like that. And they said, well, what about my insurance? And I said, well, I'm glad you asked that question. We will be glad to help you maximize your insurance benefits, but you do need to realize in major dental cases, and you have a lot of dental work, your insurance is not a factor. So if you're dependent on your dental insurance to get your teeth fixed, that's not going to happen. So I just need to be honest with you. Our fees are very fair. We'll be honest with you, but you do have an investment you'll need to make in your mouth if you want to fix your mouth and get it healthy. So we'd love to see you. Now, you will be here for about 2 hours next time, so please block off that amount of time on your schedule. And we look forward to helping you, and we'll study your mouth, and let's just become family, and we want you to be friends of our practice. God bless you, and thank you. I'll see you next time.